Today, we will be discussing the issue of substance abuse in Indiana, why it matters in our community, and what we can do to fix this problem. So, what's the problem? Substance abuse, and mainly that of opioids, is becoming more and more common in the state of Indiana. It leads to many deaths and health issues for those involved in abusing harmful substances. As this problem continues, Indiana has become the state that has the greatest amount of deaths that were caused by issues of substance abuse. So why should we care? Well, the well-being of families rely on several factors that involves action from fellow Hoosiers and the state government. If we don't push to create facilities that help treat patients or decrease their prescriptions of opioids, then the generations ahead of us will suffer severe mental and physical trauma. This will lead to the worsening of mental health and lead to more suicides, more violence, and less educated Hoosiers. What are some effects of substance abuse? Well, for starters, some effects can be long-lasting and permanently damaging to the health of users. Also, the misuse of drugs leads to damage in the changing of your brain. It also leads to higher risk of unintentional injuries, violence, and domestic abuse incidents.
In the year 2017, the amount of people with opioid prescriptions in Indiana was around 74 people out of every 100. This is typically due to the fact that opioid prescriptions were given at higher rates to those that were on Medicaid. There was a great difference between Indiana's amount of opioid prescriptions and the national average. The country had an average of about 59 people of every 100 are using prescribed opioids. There is also reported to be 1 in 10 people living in Indiana from ages 18 to 25 that take part in non-medical use of prescription pain medicine. This goes to show how Indiana is a state that is heavily affected by overusage of opioids, and the amount of people that use opioids because of addiction or an actual need for them is very large and affects many citizens in the state of Indiana. Because so many people in Indiana are struggling with substance abuse, the next generation of children are also being affected. From the year 2000 to the year 2012, Indiana reported maternal opioid use increasing 5-fold. Later, in 2017, about 14% of babies born in the state of Indiana were tested positive for opioids. Mothers that use drugs and opioids during their pregnancies can cause harm to their babies, resulting in birth defects, premature births, or even miscarriages. The babies can also be born with a dependency on the drug and experience the withdrawal syndrome known as neonatal abstinence syndrome.
How will this impact our community? Well, knowing or being related to someone who deals with substance abuse is very psychologically damaging and can cause those same people to seek drugs as a gateway away from pain as well. More people coping with addiction means less people who are out in society being productive citizens. It's saddening to think that young people are dealing with such dark and dangerous issues when there is so much more for life to offer. So, what are some possible solutions? One possible solution is the expansion of residential or inpatient treatment facilities. According to research, we do not have many facilities for substance abuse victims to go to in our state. If we increase the amount of treatment facilities that are open to substance abuse victims, then we can help decrease this issue. Another solution would be the Inspect integration into electronic health records. Inspect is basically an online system where you need to track certain pharmaceutical drugs that are prescribed to patients. For example, if you are a pharmacist and you want to prescribe opioids to a patient, you need to keep track of that on this Inspect program. Now, if we transfer this Inspect database onto electronic health records, then people in, say, ER situations and health practitioners of some sort, perhaps a doctor, would be able to see, oh yes, this person was prescribed opioids, we need to make sure, or we can expect to see that in their body, and perhaps they overdosed on that. So it just makes for a faster connection and decreases a lot of time within this emergency environment. Another solution would be to provide funding for more recovery/peer support programs. And another one, which kind of relates, would be the increased importance of post-treatment care by use of home visits, behavioral health providers, and other forms of peer support. Research also shows that oftentimes after people leave this treatment facility, they often don't seek further care or get checked back onto where they are, which is a problem because even after treatment, patients are often still vulnerable to the use of substances. So it's important to check back in with with these issues by having professionals come in, or perhaps even peer support groups come in to discuss these matters. These are all some possible solutions to decrease the use of substance abuse within our state of Indiana, and how to prevent it from causing death.